IRS does on behalf of the country. You know, Dr. Bustani raised the issue of the health care reform bill. And I think there's a lot of misinformation, a lot of misperception about the role that the IRS is going to play in the implementation of the recently passed health care bill. So let me ask you a series of questions, and as much as you can, just answer yes or no to clarify some questions that I have about the exact role that the IRS will play. But the health care bill that was just signed by the President is not going to fundamentally alter the relationship of the IRS with the American taxpayer, will it?
No.
And you said that right now you're moving forward as far as doing calculations as far as the costs and the staffing needs that the IRS has, but you haven't made any of those final determinations yet, have you?
That's correct.
And the IRS agents are not going to be going out and auditing taxpayers to verify if they've obtained acceptable health insurance, will they?
No.
In fact, it's going to be the insurance companies that will be merely certifying whether or not an individual has obtained health care coverage, and they'll be certifying that to the IRS.
Yeah, it's probably worth me just
Sure.
being very clear, because I think there's been some misconceptions out there. The way we envision this working is HHS, Department of Health and Human Services, and the exchanges will be working with the insurance companies to determine what is acceptable coverage. All that will happen with the IRS is similar to a current 1099, where a bank sends the IRS a statement that says, here's the interest someone owes, and they send it to the taxpayer. We expect to get a simple form that we won't look behind that says this person has acceptable health coverage. There'll not going to be any discussions about health coverage with an IRS employee.
In fact, I would envision that the major role the IRS will play is trying to get information into the individuals' hands and businesses about the various tax incentives that the health care reform bill has and how they can best access those incentives and utilize them. Is that right?
Yeah, I mean, the role of the IRS is going to be, again, the tax portions of this, not the health portions of this. And what we're going to do is try to make sure people are educated, there's information, we process payments quickly. We also will make sure that there's no fraud and abuse in the system, as we always do.
I mean, so the IRS is still going to pick up the phone and answer questions in regards to tax incentives under the health care bill. And
Yes.
I assume the IRS will try to build some type of online education service, too, for people to access as far as what they're eligible for.
Absolutely.
And that you'll probably be performing some additional outreach services with businesses and taxpayers about
Absolutely.
the health care bill. And as you indicated to Mr. Etheridge, you're already moving forward on the 35% tax credit that small businesses are going to be getting this year already with enactment of the health care bill.
That's our first move.
And no taxpayer is going to be subject to any IRS liens or levies or jail time for failing to disclose insurance requirements to the IRS?
That is what the legislation calls for, yes.
And as soon as your internal review is done, I assume you're going to report back to Congress what type of resources you'll need for staffing or for additional funds in order to implement the health care bill?
Yeah, I do want to be clear, as I was with Mr. Bustani, we will need resources to implement the tax provisions in this legislation, and we'll look forward to working with the committee to make sure we have the proper resources to serve the American people.